afternoon, everybody. Thank you very much for joining us. My name is Patricia Houston, and I'm here with Ashley Purper from the Rutgers Cancer Institute. Welcome, Ashley.
Yes, thank you for having me.
I want to mention that it's from the Rutgers Cancer Institute of New Jersey. Hey, Ashley.
Yes, that is the full name, but Rutgers Cancer Institute works just fine.
I want to make sure I get that right. And I just want to remind everybody that this luncheon is brought to you by family partners of Morris and Sussex County. This presentation is going to be recorded, and at the end, we are going to allow time for Q&A. That part is not recorded. So Ashley is going to talk today about controlling your cancer risk. And in relation to this specific topic, Ashley is going to cover information about hereditary and lifestyle risk factors for cancer. But not only that, Ashley is also going to touch basic in regard to the genetic testing and risk assessment, right, Ashley?
Yes.
Ashley, anything that you would like to share with us before we start with this presentation?
No, just I'm happy to be here, and thank you for having me. So just 1 second, I'll see if I can get my screen shared. I know we did test it out, but let's see.
Yeah, and I just want to remind you, everybody, that all that information in relation to contact information and the description of this presentation is going to be right below the video. So if you have any questions about contact information, all of that is going to be there. So Ashley, you're more than welcome to take the lead.
All right, great. Thank you so much. Well, as mentioned, my name is Ashley Purper. I am from Rutgers Cancer Institute of New Jersey, and today we will be talking about genetics and cancer. So just a quick disclaimer before we jump in that this is for educational purposes only, and to please see your doctor or other qualified healthcare professional with any questions specific to yourself or a medical condition. Okay, so today's objectives, we are going to learn how cells mutate and initiate cancer growth. We are going to talk about the difference between sporadic and hereditary risk factors. We're going to discuss gene function as it relates to cancer and understand how cancer genes can be passed down through a family. So before we really jump in, I do have a little pre-test here. I understand some of you may be watching this after it is recorded. So if you have something near you, pen and paper, or phone, or even just in your head, just think about what the answers to these may be. So these are all true-false statements. So the first statement, you will always get cancer if you carry a gene mutation. You can pass along a cancer-linked mutation even if you don't develop cancer. You can make lifestyle changes to reduce your cancer risk. And age is the #1 risk factor for cancer. Again, these are all either true or false. We will launch this again at the end of the workshop just to see if anyone's answers may have changed, and that's when we will discuss the answers. So I'll just leave this up for a few more seconds just so everyone has time to read it, jot down your answers, or just think about your answers. All right, again, like I said, we will go over this again at the end, and that's when we will talk about the answers. So what is a risk factor? Well, a risk factor is anything that increases your chances of getting a disease. In this case, cancer. Today, we will be separating cancer risk into 2 categories. We have hereditary and sporadic. Hereditary risk factors are passed down from your biological parents. Hereditary cancer risk is linked to inherited gene mutations, which have been proven to be related to certain cancers. It's commonly thought that cancer runs in the family. While this may be the case, only about 5 to 10% of cancers are actually hereditary in nature. Sporadic risk factors develop over the course of a person's life. These can be anything from lifestyle habits, exposure to certain chemicals, exposure to radiation, or even just the natural aging process. As we will discuss a bit later on, age is actually considered the #1 risk factor for cancer. Basically, all cancer is due to genetic mutations. It is just a difference on whether these mutations are inherited from your biological parents or they develop throughout the course of your life due to a sporadic risk factor. Cancer, like many other diseases, is a genetic disease. The word genetic is often misused in reference to illness. Here we are using genetic to refer to the gene itself. which, when altered, can cause abnormal cell function, abnormal cell growth. And it's this uncontrolled cell growth is what leads to the formation of cancerous cells. Cancer is primarily a disease of aging, and this is because it generally just takes a while for mutations to lead to cancer. As we age, it becomes extremely important to stay up to date on healthcare appointments, especially your cancer screenings, since many cancers can be prevented or detected early as a result of screenings, routine blood work, routine physicals, etc. Before we dive really deep into cancer risk assessment, I just want to briefly discuss what's actually happening in our bodies. Every person is made up of around 37 trillion cells. A person's genetic material is located within chromosomes in the cell center. A genetically healthy cell includes 46 total chromosomes, with 23 being inherited from each of our biological parents. DNA, which is considered our genetic instruction manual, is located within these 46 chromosomes. As we see in the image on the slide, human genes are located within the DNA. Most of the over 20,000 human genes are exactly the same in every person. However, the genes that vary, which is actually less than 1% of all genes, are what make us different in personality, appearance, and disease risk. To summarize, the gene can be considered the basic functional unit of heredity. As we've mentioned, each person inherits one copy of each gene from their biological parents. Genes are especially important for producing proteins, which carry out vital functions in our bodies, which can be anything from preventing tumors or killing off damaged cells. We can almost think of genes as notes on a sheet of music. If everyone started out as the same song, we can change individual notes, we can change little sections of the music to create an alternate tempo or scale or pitch. Family members often have similar genetic makeups, which is why siblings and cousins may look very similar, and also why some diseases seem to run in a family. Here we have a diagram that shows how cancer might be passed down in a family. Since genes are passed down from our parents, who also have two sets of genes from their parents, we have a chance of inheriting 2 of 4 versions of any given gene. Let's take a quick look at the graphic. So the male at the top of this diagram in red, the top left in red, is with a woman here who is unaffected by cancer. She does not have cancer, does not have a cancer gene, is healthy in regards to cancer. While the male here in red does have cancer, and this cancer is linked to a genetic inherited gene mutation. You can see that their children, the second generation here, is sort of a mixed group. We have some children here in red that did inherit the gene and develop cancer. We have some here in yellow, which inherited the gene, but don't have cancer. And then we have those in blue here, which, again, healthy in terms of a cancer standpoint. No mutation, no cancer-linked gene, anything like that. And then you can see here, this male in yellow, they have the cancer gene, but do not have cancer. They have children with someone who is genetically healthy from a cancer standpoint. And unfortunately, this third generation here, some of them can develop cancer. So you can pass along the gene to your children without having the cancer yourself, which is why it's important to understand your family history. So a mutation is a change or changes to a person's DNA, generally due to a gene level issue caused by an error during cell division, a viral infection, chemical or radiation exposure. Although the word mutation usually sounds bad, it sounds very negative, but not all mutations are bad. They may be beneficial and helpful, such as, being a very fast runner or having a photographic memory. And some mutations just don't have any effect on a person at all. They're just very neutral, not good nor bad. So it's not always a negative thing to have a genetic mutation. When we do have a mutation, they do carry over when cells divide and copy. Just like humans, our cells have reproductive and life cycles, with cell death being predetermined or programmed. When cells age or are damaged, new cells eventually take their place. Because certain genes control the process of cell division, when one of those genes is damaged, it leads to an uncontrolled growth of abnormal cells. This uncontrolled division is how cancer forms. Because abnormal cells are capable of faster growth and division, they are able to overtake the environment around them and turn healthy tissue into unhealthy tissue. Here we have an example of normal cell division at the top. You see these 4 red cells, they are normal. The cell gets damaged, and then the cell dies, which is what's supposed to happen. However, in terms of cancer growth and cancer cells, you'd have this cell damage, but that programmed cell death doesn't happen because that part is damaged. So these cells just keep growing and growing and growing and dividing, and this is actually what can lead to tumors. Tumors have the ability to affect and alter healthy cells in their proximity. In this diagram, you can see the normal cells, which are this purple pink color. They're very similar in size and structure. They look very similar. But then in the middle here, you have these tumor cells, these blue cells. You see they're bigger, they're all misshapen. They don't look like all the cells around them. Because tumor cells grow at a fast rate compared to healthy cells, their genetic makeup is also subject to constant change. Similar to how mutations can form in healthy cells, tumor cells can also mutate and change. And since they are growing faster, these mutations happen faster. Tumor cells can also detach from the original tumor and spread to other parts of the body. This is the process of metastasis. This is a feature of an advanced cancer, which often becomes much more difficult to treat than one that is detected early. So earlier I mentioned the difference between hereditary and sporadic risk factors. Hereditary risk factors are those that are passed down from our biological parents, while sporadic risk factors develop over the course of a person's life. And again, these can be anything from lifestyle habits, exposure, or the natural aging process. Some of the most common sporadic risk factors for cancer are also considered risk factors for our overall general health. These factors include smoking, being overweight or obese, living a sedentary lifestyle with very little physical activity, a poor diet, alcohol use, sun exposure without proper protection in the form of sunscreen or shade, hats. Also exposure to certain viruses such as HPV and HIV. These can all increase your risk for cancer. Oftentimes, it is believed that cancer might run in a person's family, but as I mentioned, only about 5 to 10% of cancers are actually hereditary in nature. In most cases, the cancer itself isn't related to the genetic mutation, but it's a common lifestyle and behavioral lifestyle among families that make multiple members of the family more susceptible to disease and cancer. For example, if food insecurity within a family over an extended period of time, over many generations, may result in poor dietary habits across generations. So while that gene isn't technically being passed from parents to children, that lifestyle is, and so that's why we see similar diseases in families. Here we have a graphic that displays the percent of cancers in adults over 30 years of age that are directly related to each of these sporadic risk factors. You can see this red bar here, that tobacco use actually has the highest link of cancer, with almost 20% of cancer cases being attributed to cigarette smoking or tobacco use. Your personal cancer risk can also increase if multiple risk factors are present. For example, if a person smokes cigarettes, drinks alcohol every night, and has a poor diet, their cancer risk may increase over someone who say, is relatively active, eats a healthy diet, but smokes cigarettes. The good thing is we can change the way we behave to reduce or manage our personal cancer risk. Constant practice of unhealthy behaviors can result in what is known as epigenetic change. Rather than the gene being mutated, this epigenetic change is like the instruction manual for how the gene is expressed in your body. So the gene itself isn't altered, it cannot be passed on as altered, but the gene is being expressed poorly. But the good news is, we make these lifestyle changes, we quit smoking, we cut down on our alcohol, we work out a little bit more. We can change these factors and we can actually give ourselves a better outcome. But despite all of those behavioral risk factors, cancer is mainly a disease of aging, meaning your likelihood of developing cancer increases as you get older. In the United States, about 87% of all cancer cases occur after the age of 50. This is because cancer generally requires an accumulation of factors to occur over a person's lifespan. As we age, we accumulate more exposure to sporadic and environmental factors, which may act on their own or couple with some of our hereditary factors that will eventually lead to cancer. On this graph here, I did put a little box around the age range of 50 to 54, and you can see how after that age range, cancer really increases. So once the age of 50, we can see the higher risk of cancer. Here we have the average age of diagnosis for the 4 most common cancer sites in the US. We have breast cancer at 61 years old, prostate at 66, colon and rectum cancers at 68, and then lung and bronchus cancers, the average age is 70. We see that breast cancer has the lowest average age than the rest of these, and that's because there are many breast cancers that are hereditary in nature, and these occur at earlier ages. Similarly, prostate cancer also has a strong genetic link, the genetic mutation link to it. So we will be discussing a specific gene in a few slides that is heavily linked to breast cancer. So cancers that are caused by hereditary factors, as we just mentioned with certain breast cancers, are diagnosed at an unusually young age. This is often a telltale sign that your cancer may be linked to an inherited gene mutation. Other potential traits of hereditary cancers include, multiple cancer types in one person, and just those unusual rare cases of cancer. There are some hereditary syndromes that have very serious effects on genes that would normally act to prevent the formation of tumors, leading to many instances of uncontrolled cell growth and division. As we know, hereditary cancers make up the minority of cancer cases, but there is still a possibility that if a type of cancer runs in your family, it may be associated with an inherited gene being passed down through the family. So we're going to use the BRCA1, which is sometimes called the breast cancer gene, as an example. The BRCA1 gene, commonly referred to as the breast cancer gene, is responsible for repairing damaged DNA and suppressing tumor formation. When this gene is damaged or mutated, it is heavily linked to hereditary breast cancers. Before the age of 80, roughly 72% of women with this BRCA1 mutation will develop breast cancer, while 44% will develop ovarian cancer. There is also an unrelated gene known as the BRCA2 or breast cancer 2 gene, which does have similar effects on hereditary cancer risk. Here we see the effects of a BRCA gene mutation on breast cancer risk. Women with this mutation are over 7 times as likely to develop breast cancer during their lives. This is illustrated here on the far right, that 87 out of 100 women with a BRCA gene mutation will develop breast cancer. This is compared to only about 12 out of 100 women who do not have this gene mutation. We see similar risk for ovarian cancer. We see here on the far right that those with this BRCA gene mutation, 40 out of 100 women will develop ovarian cancer, compared to 1 to 2 out of 100 for those who do not have this genetic mutation. When considering hereditary disease, it's important to remember that we do receive 1 copy of each gene from each of our parents. This means that genes do not discriminate by gender. A mother can pass along a damaged gene to her son. A father can pass along a damaged gene to his daughter. Oftentimes, and in the case with the BRCA1 gene, a damaged gene is linked to heightened cancer risk in both men and women. Men who carry this mutation are more susceptible to prostate, pancreatic, and male breast cancers. And you can see in this family tree, this woman at the top here had breast cancer at the age of 48. The next generation, we have a person with ovarian cancer at the age of 53, someone with male breast cancer at the age of 61. And then down here in the bottom generation, this person actually developed breast cancer at the age of 35. So you can see the ages of diagnosis kind of get younger and younger each generation, and that both men and women are at a heightened risk if there's this gene mutation in their family. All of this information highlights the importance of knowing and understanding your personal cancer risk. If possible, try and find out any relevant medical history from family members, and make sure to share as much of that information as possible with the rest of your family and your healthcare team. There is even a possibility that your cancer screening recommendations might change based on your family medical history, especially if there is a known inherited gene mutation. So I do have a quick video here. It's only about 2.5 minutes. I just like to show it because it really gives a firsthand experience of what we were just describing. So I will play it. Please let me know if I did share sound, but you know, sometimes it doesn't work. So just let me know if you can't hear it.
That's my great daughter.
And this is my father, my amazing dad. And he's a wonderful support system.
So I remember I was showering, I felt the lump on my right side. So I went to my primary doctor and she examined me and she says, you know what, let's get it biopsied. About a week later, they called me, they said, all right, you have male breast cancer. Then I said, y'all playing with me. Men don't have, you know, they don't get breast cancer. And they said, oh, you got to get genetically tested. And through that, I found out that I carry the BRCA2 gene. I said, wait a minute, I could give this to my kids.
He called and was trying to explain it. And at that time, I think I was like, I'm 32, I'm young, no problem. But then my doctor, she's like, just to be proactive, let's get a mammogram. And that's when they found my cancer.
So right there, I hit rock bottom. You know, I took it as, wow, I passed this on to my kids already? But she said, Dad, we're gonna beat this. Don't worry about it, we're gonna beat this.
He would go to my chemo treatments, I would go to his. Yeah.
And that's how we got through. We got through.
You always hear father and daughter bond of dancing or fishing or basketball. But our bond and what got us close together was breast cancer. You know, I think he saved my life. Because if he did not find this, by the time I would have hit 40, it would have been too late.
She was my rock. And she's my daughter and I love her dearly. But she's my friend.
All right. Again, I just like to use that video to highlight the importance of knowing your family history and how, you know, your cancer risk may increase if there is that inherited gene mutation. And it also shows that these genes don't discriminate based on gender. You know, we saw a father that did pass this along to his daughter. It's not just women passing this along to their daughters. So for an example of how screening recommendations might change depending on a person's cancer risk, we'll use the breast cancer screening recommendations. So, you know, at the age of 40, a woman at average risk is when she would start getting mammograms, and then that would continue throughout the next couple of years of her life. Now, those who are at high risk, so those with a known genetic mutation, or those who have a lot of first-degree relatives, you know, with breast cancer, they actually might start getting screened at the age of 30 rather than 40. As we saw with Vanessa in the video, she had her first mammogram at 32, because they discovered there was that gene mutation in her family, and they actually did find breast cancer. And she even noted, had she waited till the typical recommendation of 40, it might have been too late. She would have already had the cancer for almost 8 to 10 years at that point. So that's why it's really important to know this if you can, and stay up to date on your screenings and explain all of this information to your physician. So to wrap things up, we're just going to discuss how the knowledge of hereditary risk affects cancer prevention outcomes and even treatment. So one potential service is genetic testing. Genetic testing refers to the processes and techniques used to determine details about a person's DNA, which will reveal important familial health information and potential disease risk. This information includes potential cancer-related gene mutations, heightened cancer risk. As we've seen, there are cases where a person is at an extremely heightened risk of cancer due to hereditary causes. Genetic testing can also be useful after a diagnosis takes place. Certain tests can reveal how a person may respond to certain treatments or medications, which can help optimize a patient's treatment plan. So there are a number of different genetic tests available that can be used to help identify a person's risk of inheriting or passing on certain gene mutations. So we have predictive testing, which is done before symptoms are present and determines a person's disease risk if a family member is known, has a known genetic disorder. We have diagnostic tests, which confirm or rule out genetic disorders. Pharmacogenic testing gives the healthcare provider an idea on how to best treat a patient and also how to avoid as many side effects as possible. There are reproductive tests that can be done before, during, or right after pregnancy. These are used preventatively to find out if a person carries a gene and genetic variants that their child might inherit. A big thing that I've seen over the last few years are these direct-to-consumer testing, something like 23andMe, these tests that can be completed at home, and then you send your sample into a lab and they send you a fun little report back. So this is just an example of a genetic testing panel. You can see the left-hand column includes the different genes that may represent a heightened risk of breast cancer, while the column on the right indicates the associated cancers and risk potential. So, if patients are concerned that they may have an inherited gene mutation, you may want to refer them to a genetic testing company or go to seek genetic testing. Again, this is something you would discuss with your primary care doctor, and they would determine if this is something that you may need. So another option that is out there is genetic counseling. Genetic counselors are healthcare providers who have specialized knowledge in the field of genetics as well as counseling. They can specialize in many different healthcare fields, including prenatal health, pediatrics, cardiovascular health, and oncology. Genetic counselors can be especially helpful in sorting out resources regarding inherited conditions that may affect a patient or their family members. They can help guide you in further tests and next steps in the process. They can even offer psychological support, including shared decision-making, and really adapting to this new knowledge of a condition or a heightened risk for a condition. This slide just contains some helpful resources regarding genetic testing and counseling. So there is a program through the Rutgers Cancer Institute of New Jersey called the Life Center. It is designed for individuals who are concerned about their risks to develop cancer based on family history. So genetic counselors from the HOPE program here are also available to see clients in Princeton, Hamilton, Somerset, and Long Branch. So the National Cancer Institute and the American Cancer Society also have tons and tons of information on genetic testing and great directory of resources. I will also at the end, Patricia, I'll just email you a great resource that offers assistance on how to talk to your family about a cancer diagnosis or potential cancer diagnosis or family cancer risk. It's called Let's Talk, and I think it's a great resource for people to utilize. I also like to say a bit about a great screening resource available under the New Jersey Department of Health that may be able to assist underserved residents in need of cancer screening. The New Jersey SEED program provides screening services for breast, cervical, prostate, and colorectal cancers. These services include education, outreach, early detection, case management, screening, tracking, follow-up, kind of a full roundabout of services that you may need. All 4 of the cancers that NJC provides screenings for can be treated more effectively when detected early. And NJC does have at least one program in all 21 counties. So no matter where you are in New Jersey, you do have access to an NJC program. In order to utilize these NJC services, a person must be at or below 250% of the federal poverty level and be uninsured or underinsured. We also have a great team here at Rutgers Cancer Institute of New Jersey, our patient navigation team. Our patient navigators can help guide community members to cancer screening services and help them address any barriers they may be having in accessing those screening services, whether it's financial issues, insurance issues, transportation issues. They can help guide someone through the process. And this is, again, completely free of charge, fully statewide, all 21 counties. Wherever you are in New Jersey, they'd be able to help you. And we have made it back to our post-test. Again, if you are watching this at a future time, not in the current moment, I will just give you a few moments to really think about your answers or jot them down if you feel like it. Again, these are all true-false statements. They're the same true-false statements as at the beginning. So if you want to take a second, pause the video to write it down. If not, we will go over the answers right now. So statement 1, you will always get cancer if you carry a gene mutation. This is false. You can be a carrier without developing the cancer. Number 2, you can pass along a cancer-linked mutation even if you don't develop cancer. This is true. We saw that in that family history graph with the red, blue, and yellow little people, that those that were yellow on that family tree, they had the mutation, but they did not develop cancer, but they did pass the cancer along to their biological children. Number 3, you can make lifestyle changes to reduce your cancer risk. This is true. As we saw, if you smoke, you can quit smoking, cut back on alcohol, eat a healthier diet, be a little bit more active, just really make those changes to reduce not only your cancer risk, but other chronic disease risk as well. And number 4, age is the #1 risk factor for cancer. Again, this is true. As I mentioned, oftentimes cancer just takes a few years to develop. So, the more years we are alive and exposing to different risk factors, the more likely we are to develop cancer. All right, and that brings us to the end of the presentation. Thank you so much for joining me today. I do have an evaluation survey. There is a QR code here on the screen that if you are able to scan it, fill it out, it greatly helps both myself improve and the Cancer Institute improve on our programs moving forward, so we can give the community what they need and what they're looking for.
Thank you very much, Ashley. And also, I just want to thank the Rutgers Cancer Institute for New Jersey for providing this information to us and to the community, making this information available to the public in general. So thank you, everybody. Ashley, any final thoughts before we conclude with this presentation?
My final thought would really just be talk to your family, get as much information as you can. I know there are certain situations that makes that really hard, but if you do have that available to you, talk to your family and share that information with your healthcare provider.
Thank you. And I just want to remind everybody that all this information is going to be in the YouTube channel of the Organization Family Partners of Maurice and Sussex Counties. So all that information is going to be there. Right now, we are going to move to our Q&A session, and that part is not recorded. Thank you.